Hi, good day. I'm coming again from Natural Living Center. I must say Happy New Year to each and every one of you. 2018 proved to have its challenges, but 2019 brings a lot better things that we are hoping. But you see, in everything that we're dealing with, we still have to look at our health because without our health, there's nothing. We can't do anything if we're unhealthy. Now, I want to start off this new year by dealing with the reproductive system. I want to look mainly at the female and the male, but mainly the male, because what I've realized is that we have a lot of young men today dealing with prostate issues. In women, we have women dealing with fibroids and polycystic ovarian syndrome and endometriosis and things like these. Now, men, long ago, prostate issues used to be a old man thing. That's not the case today. Today, we are seeing men as young as 20, even younger, with prostate issues. Now, most times when men get erectile dysfunction is when they start to look into what's happening with the prostate gland. Women is only when you start to see issues with the period or too painful, or you see that blood flow looking strange, it looking deep red and clotting and things like that. And then you start to look at your health in that area. But I want to zone in on the men here for a while. Men, when you're dealing with prostate problems, most times you have to get a exam by a doctor to determine if that prostate is swollen or calcified or things like that. Now, most men do not like to go and get that examination, but it's a good thing to do to get it. If your diet is not optimal, I will tell you definitely get an examination done. Three things happens with prostate health. One, there's swelling. And when that gland starts to swell, you find you have what we call here stoppage of water, or you get that obstruction in the flow of the urine. Second thing is calcification. And these calcifications could come in one piece or it could come in clusters. And many times what causes calcifications, there are several things: tumors, surgery, the way you eat, many things causes calcification. So the gland starts to harden upon you. And the third thing is inflammation, or what you call prostatitis. All right. Now, when these things start to happen, how do you know you're dealing with a prostate problem? One, you're getting up at night three times, four times, some men as much as six times getting up to urine at night, even though you would have urinated before going to bed. And anytime you see that you have to be getting up all throughout the night going to urinate, know for a certainty you're dealing with a prostate problem. If it is that you realize that you want to urinate, you're feeling the sensation, but you cannot urinate, get to the doctor. Make sure to get to the doctor. You see, many times this thing is left unchecked, and it's a dangerous thing to do. You see your belly swelling. When you see the point of your belly swelling, now you start to talk about bladder infections could start to take place here with you. So I definitely will tell you, go and have your prostate checked. In women, you're dealing with polycystic ovaries and fibroids and things like that. And you start to feel the discomfort when your belly starts to swell, or you go to the doctor and you get a diagnosis of multiple fibroids, things like that. Now, fibroids, polycystic ovaries, endometriosis, and even prostate issues, they all start from a gland in the brain. So even when you go to the doctor and they're dealing with the gland itself, the prostate gland, or they're dealing specifically with fibroids, this gland is always left unchecked. What causes this gland to shut down, which is your endocrine gland, your hormone producing gland, is the foods that we eat. Everything that we eat and it's processed, we have problems because the processed foods causes that endocrine gland to start to shut down in as much as an hour, 1 hour. Let's say you drink something with high fructose corn syrup in it, or any drink you pick up in the supermarket and you see sodium benzoate in there. It's a neurotoxin, so it starts to shut the gland down. But the prostate and the uterus and these things, that is just the reproductive gland. That's just one area, but it shuts down several areas of the body. So while you're dealing with the glands and you're dealing with the feelings, the symptoms that you're getting, the diet has to change. Give us a call, 623-8209 or 692-7097. Come in and see us. Don't play with this thing. I want to start the new year with this because it is so prevalent today and too many people are suffering. You have men going to get the PSAs done. Some men you see in PSA of 5, some men you see in PSA of 40. And you tell yourself that when your PSA is that high, that you have prostate cancer. But I beg to differ. There are men with PSA of 5 with cancer and men with high PSAs without cancer. It is not so much about the PSA check. Check your diet. Don't neglect to do it. Have a good day.